hernia has a particular medical definition. It essentially means an opening that has content in one side of the cavity that doesn't belong there. So for example, let's take the simplest part. Somebody comes and tells me, oh, I have an umbilical hernia. There is a little ballooning outside of the abdominal wall, and they feel something either puffy, they feel something that gurgles, and essentially that could be their bowels. It's an abnormal opening that has content that shouldn't belong there. Your bowel should not belong outside of the abdominal cavity. It is a really complex disease. It's not one simple disease. So people can have an inguinal hernia, people can have an umbilical hernia, or a lot of people who've had surgery can have what's called a surgical site hernia. But you can also have hernias that are actually internal, such as a hiatal hernia. And that can cause other problems. So a hiatal hernia, for example, can cause reflux, severe reflux that's not responding to medical treatment. That certainly needs to be addressed surgically. Inguinals, hernias can cause quite significant symptoms too, and they can cause bowel obstruction, because if the bowel gets stuck in there and it twists on itself, then it will not be able to go back into the cavity that it belongs, which is the abdominal cavity. That could actually expose it or have a risk of it becoming incarcerated and then what we call strangulated. So it can cut off its own blood supply, and that portion of bowel could actually potentially die. The signs and symptoms of hernias could be variable, but essentially any hernia that has either bowel or abdominal content kind of sticking out, so things like inguinal hernias or things like surgical hernias, things like umbilical hernias, some of the symptoms are pain, essentially. If you have pain, you need to see somebody about it. Sometimes, even if there is no pain, but you feel an abnormal lump there, I still think you need to see somebody, because that could potentially progress into something more significant and severe. Anytime we can fix these conditions, we can fix a hernia in an elective manner. Essentially, you could come in the day of the surgery and you could go home later that afternoon. However, if this becomes an emergency, as in there's a lump that's actually stuck there and we cannot push it back in, that becomes a surgical emergency. And that is a much more complicated problem, and your hospitalization course could be quite protracted after that. Since hernia disease is a complex and a wide variety of diseases, you really need to see a place that does many of these. So essentially at Memorial, what we do is we essentially do hundreds of hernia repairs a year. And we have a quite systematic approach to these hernias. And we have also quite extensive knowledge and expertise in treating and dealing with hernias. And we use a wide variety also of approaches. So for example, we can start with something that's called a simple open approach. So if the hernia is very large, and what we need to do is to open that hernia, clean up around it, and also bring the abdominal wall back together. But not just that, but we also do more complex and advanced techniques, such as something called a component release. So we can do more complex repair this way. And then we can put biologic meshes on top of it, which are very special meshes that we use. And then we repair it almost like in 3-type layer repair. And we also utilize quite a lot in a minimally invasive approach. And with minimally invasive approach, we can either use it laparoscopically, which means you have small incisions, and we will repair the hernia that way, with or without a mesh. But we also use the robot, and we can repair that robotically. These are very complicated repairs that cannot be done everywhere else. The approach to this disease really needs to be individualized.